Good evening, everyone. It's a pleasure to be here, and I'd like to welcome especially the board members to Bruce County, Great Bruce. Really appreciate you having a presence here, and we're being allowed to brag a little bit about our services. We especially thank you for the funding that we received, and especially the enhancements that we've enjoyed in the last couple of years with the pouring out of the capacity report by Jim Whalen. So I'm here to talk a little bit about mental health services, and then I'm going to talk more specifically about a new service that we have to offer to give you an idea of what a specific program looks like in mental health. There are 4 providers of mental health services, adult mental health services in Grey & Bruce. There is CMHA, there is Grey Bruce Health Services, there is Hope Grey Bruce, and there is G&B House. G&B House is a residential recovery home for men with substance abuse. The other 3 organizations are in a legal partnership and have formed 5 mental health teams throughout Grey & Bruce. And the idea of that was to bring together the services that individual agencies had and offer them to the client closer to where they live. And so these mental health teams, they're located in Southampton, Kincardine as a satellite for that. There's one in Hanover, Markdale, Holmestown, and Wiarton here in Wiarton. So they have a variety of services that are offered through these mental health teams, and they could have employees from any one of those 3 agencies that are in a partnership. They offer services like case management, counseling, housing support, and social recreation. And all those services are provided in each of the mental health teams. Besides that, each of these agencies also have specialized programs that are not part of the mental health teams, and they provide a variety of services. Things like court support. There's the Grey Bruce Health Services has a withdrawal management program. They operate a number of other programs, and if you want specific knowledge on those, we can maybe cover that in question and answer. I'm afraid it would be a little too much like a grocery list to go through every one of them. There's probably about 30 different programs that are offered. But they all serve the same population, 16 and up, and we do have a very strong network and work together wherever we can to have a seamless system for the client. So one of the programs that the LINS has recently funded is the Urgent Response Team. And I just wanted to talk to you a little bit about that because it's a very new program, and we've had to be very innovative with it in order to be able to roll it out in areas such as Grey & Bruce. So the idea of the program, or the mandate, is to reduce the incident of admission or readmission and utilization of hospital inpatient services by working collaboratively with first responders, health professionals, and community stakeholders. So one of the areas that we know the LINS is working on is reducing emergency room visits. Mental health clients make up a high percentage of emergency room visits, and although we're glad that they're there and they sometimes very much need to be in the emergency room, there are other times where we feel with community supports there may be avoidable visits. And so that's the whole idea behind this new team. It's a 7 FTE team. There are 9 people that work on it. They're located in 4 different communities throughout Grey & Bruce so that we can have a best practice response time of about 55 minutes. And the whole idea is to reduce those unnecessary emergency room visits. As we know, that's the most expensive way to deliver mental health care is through the emergency room. Okay, we could just move on. So, we work with people with serious mental illness, And we provide intervention to reduce the incident, duration, and intensity of a mental health crisis. So this isn't just a business proposal to help save money. It's also good for the client. And too many clients with mental health issues or that go into crisis end up in the back of the cruiser on their way to hospital. And we really feel from a client perspective that support in the community is much better for them. So we act as a resource to other services in Gray and Bruce County, such as the mental health team. As far as responsibilities, we do work either by telephone or by on-site visit. So I'll give you a scenario in a minute. We work in collaboration with first responders and emergency rooms. There are 8 police jurisdictions in Gray and Bruce. You try and get 8 police chiefs in a room together and design a common protocol, and you know why I had gray hair. It was quite a challenge, and it took a while to do, but we did it. They've all signed it, and apart from that, we've been able to, at their request, to train every police officer in Gray and Bruce, every one of them, for a 1-day session to learn about mental health and learn about when it's appropriate to call us or when it's appropriate just to take somebody to hospital. We do crisis follow-up to ensure appropriate resources and supports are in place. So we will follow somebody in the community for up to 30 days, and that is to give us time to do a proper referral and to, again, not have them in the community without support. So go into crisis again, and there may be a readmission, or a revisit is what we call it, to emergency. So we're trying to avoid that also. So we will do counseling with the people. We'll find them housing, we'll get them back on medication, we'll try and get them in touch with their primary care physician again, or primary care worker, and follow them for up to 30 days. Okay, next one. So you can imagine if we just put that number on a pamphlet and distributed it into the community, what would happen to this team? They'd be running all over Gray and Bruce. So what we've done to alleviate that and to try and really get the service to where it's needed, we only accept referrals from first responders, from emergency rooms, and from the crisis team. So let me give you a scenario. If somebody phones the crisis team because they're in crisis or a family member phones, and the crisis team is speaking to them for a little bit and just doing a little bit of a drive-by assessment, decide that what they really need is they need immediate support. They don't need to come to hospital, but they do need immediate support in the community. The crisis team would then call us, and we respond within 55 minutes to that client. So, and same with emergency room staff. There are, I believe, 8 emergency rooms in Gray and Bruce. Only Gray Bruce Health Services has a in-house crisis team. The other ones don't. So quite often you'll get a locum working in a rural hospital. They really don't know what resources there are in Gray and Bruce. They've got somebody in their emergency room. They're not going to admit them or form them, but they know that if they release them without support, they'll be back the next day, and maybe the next day. And so to stop that pattern, they would call us. And even though we haven't avoided that emergency room visit, we can certainly avoid a revisit, and that's also part of our mandate. And we use a 1-800 access line. We've come up with a pretty creative phone system where whoever is on in that area will get the call redirected to them. Our hours of operation are from 9 a.m. to 9 p.m., and that's 7 days a week, and it includes set holidays, so we're even open Christmas and New Year's. We would like to have tried to do a 24/7, but with 7 FTEs in this area, it's just impossible. It's just too big an area. And urgent response workers will be notified by BlackBerry. So we've got, like I said, a BlackBerry system. So I mentioned we're located in 4 different sites, and we cover those hours as well as weekends. And we, as I mentioned, follow up with police. We did quite a bit of work with the police to find out at what time their calls are coming in. About 20% of police calls in Grey & Bruce are mental health calls, and most of them come actually in the afternoon. And there are some at night after 9, but they quite often involve intoxication, and we can't really work with that person when they're intoxicated and do a proper assessment. So we will get their information and try and follow up with them the next day. So who are we seeing? We see a person who's suicidal, a person who suffers from schizophrenia, severe depression, bipolar disorder, or psychosis, who is in need of immediate crisis intervention. And like I mentioned, if they're highly intoxicated, we just really need to let them dry out and then revisit their issue. So we've gotten about, since we've started back in February, we really didn't get rolled until the new year because of the protocol not being signed. And since then we've had about 100 calls go out. And we're finding from the feedback in the emergency room and the crisis team that that's been very, very helpful to their work to be able to have somebody there, somebody that's trained to do an assessment, be able to do that assessment quickly. So basically we're providing immediate support for people who are in a mental health crisis but are not formed under the Mental Health Act. Like I said, if somebody needs to be formed and somebody needs to go to hospital, then that's fine. That's not our role. But it's for people that may go to the hospital and not be formed and then get released back into the community. And we follow up. So the benefits to the police, and again, we've had lots of feedback from the police. They couldn't wait for this to happen. The crisis response is immediate. Arrest and use of force is decreasing. And so if you have somebody there with good de-escalation skills, that can be very helpful and good for the client. Lower recidivism means police calls for service will decrease. Police are saying to us that they often get 2-3 calls a day for the same individual when they're in crisis. So we're hoping to reduce that. And officers no longer have to be the psychiatrist in blue. That's what they used to call them. I tell the officers when we do our training that the mental health system has really failed the police, failed the clients too, in not being there for first response. It's the only medical emergency that I can think of where a first responder was not a medically trained person. It's the only thing. If you have an epileptic seizure in the grocery store, wouldn't it be ridiculous to call the police and not an ambulance, or not a first responder? So this really is something that's long overdue. The police were being asked to make decisions that they didn't feel they were capable of making or trained to make. And they were wasting an awful lot of time in emergency rooms. The average call, when they take somebody into an emergency room, is they will remain in custody of that person and have to stay in the hospital, 2 of them for about 4 hours in Grey & Bruce. And so you can imagine the frustration of the officer who really didn't know what to do because he didn't know whether the person needed to be formed or not. And so they err on the side of caution. They bring the person to the emergency room, and they wait 4 hours to see the doctor, and there's an assessment, and they say, we're not admitting them. And then the police just drive the client home. The client might still be in crisis, but he wasn't or she wasn't formed. So very frustrating for an officer. Change the scenario to an officer attends a mental health call and somebody's having some real problems. They can call us and then we take the responsibility for making that decision. and in tandem with the police, we can say, you know what, I really think if we just go to the pharmacy, get the guy's prescription that he didn't get for 3 days because he didn't have the $2 to pay the dispensing fee, and get him back on meds tonight, maybe his anxiety would go down. And that would be a kind of service that we would do right then and there. So it can be very, very simple. It can be as simple as that, but just look at the money that saves to all kinds of services when we do that. Okay, and that's all I had for the urgent response team. I'm very excited. It's going well, and it's a real benefit to our community. So thank you. I almost forgot my other duties to introduce Pat. I brought Pat with me from Old Sound. Pat is here to do a client story. Pat is one of the nicest people that I've ever met. She is an incredible friend to so many people that come to our program. And I've never, ever, ever heard Pat utter a bad word about anybody. And so I am delighted that she would do this tonight. And I think she might have even lost a little sleep worrying about it, but we'll catch up tonight, Pat.
Yeah, statement. Yeah, okay. I'll just hand out these photographs. There are different people, mostly from Union Place, which is mostly what I'm talking about tonight, is the Union Place people, and some from community connections, and people that have, it's written on the back who they are. And I'm Pat Reed, and I live in Owen Sound. And I don't know whether Claude says I never utter a bad word about anybody. I gossip a lot, so I guess that's how I kind of So it kind of helps sometimes to know what a person's background is. So I brought that in. So the first thing I'm going to start out with is a joke. Now there were two criminals, and they were out for a walk, and they approached the woods. And the one criminal says to the other one, I don't know, it's pretty dark and dreary in there, I'm not sure, I'm kind of scared going in there. But the other one walks along with them, and they keep walking. And one says, well, you think you're scared, I have to walk out of here alone. Now, to start with that, I can tell you a little bit of something about my life. I'm not a criminal, by the way. I figure my mental illness might have started when I was a teen. I suffered then from bouts of depression, and I had my share of boyfriends, but no real close friends except Heather Instetter. And Heather and I would go jogging together out on the back roads near the farms where we lived, and we played folk song records together and even started a group to entertain people in the high school cafeteria during noon hours. She and I both played guitar and piano. I even played at her room or something. A lot of fun. And she played as well, and so did her husband. I had no treatment at the time for depression when I was a teen. I didn't start showing serious signs of mental illness till 1976 when I was admitted to London Psychiatric Hospital by Dr. McDonald from Cambridge and my parents. I had been living in a cheap rental room in Cambridge where my dad was paying the rent. I had no money and had not been eating. I had worked when I was living in Toronto before that, and also had several jobs back home. But all that changed when I moved back again to go. No prospects and no motivation, even though I was so hungry. I had severe depression in that room. I'll never forget it. When I came back from London, I got a job, moved into an apartment, proceeded to work as a production control manager. Did I say London? Yeah, when I got back from London, I came back to Cambridge and proceeded to work as a production control manager in a factory office without benefit of meds. That job didn't last long, just 2 years. Then I trained as a church camp counselor at Silver Lake and worked at a couple of camps as a kitchen assistant and arts and craft manager. But I went off the meds again, and it was inevitable. I ended up in hospital in the London Psychiatric. After I moved to Kitchener to get office work. I worked for Kelly Services, but had to move from one bedroom to another, and eventually the police had to pick me up. Again, I had been drinking heavily since losing my production control job and hadn't stopped. When I was put in hospital again as an involuntary patient, it was 1981. I didn't get out until 6 months later. The times that I did go to hospital, every time it was an involuntary patient, because so you can imagine what the police did go through. They went for a walk, and they were very patient. During that time, I was forced to undergo shock treatment at London Psychiatric. When I got out, Sister Helga helped me get into a nun's place on William Street in London. That's just on the other side of the detox in London at 534 William Street. There's a nun's house that's attached to that detox building. And I proceeded to rehabilitate, this time with the meds. But unfortunately, I developed epilepsy as a side effect of those meds. My time was spent in night courses and day courses at Brampton College, and I eventually enrolled full-time in basic business. I had in between worked full-time in an office as a secretary at EPCO Limited. My nightly recreation consisted of coffee shops with friends and attending AA meetings. They really helped me in a big way. I achieved 8 years of sobriety while I lived for 10 years in London. But I fell off the wagon in 1989. I had to be hospitalized again. 5 fan-child diplomas later, and I still hadn't learned anything. After a short stay, I got out and proceeded to live outside in the bush. I went cold turkey off all meds, including Epival, which was used for epilepsy, and stopped having epileptic seizures. Because I had a good water source, a pipe that pumped fresh water constantly into a marsh and a form of shelter, an old truck hood buried up hand in the dirt with a stick hut around it, and my homemade fireplace for warmth, I didn't perish. And it was close enough to London's West End and a bus route 2 miles away, which I walked to, so I was able to buy groceries. I stayed there a year, but the blizzards were hard to go through, and keeping wood dry for my fireplace wasn't easy. To have tinder for my fire, I picked up litter off the sides of the highways. Boy, the outskirts of London never looks so clean. I had to go a long way to pick up all that litter, so it was wet. In May 1991, I came to Owen Sound with no money and no food, having been stolen from in Hepworth, and with the help of the cops, had to stay on the 4th floor where I met Bill Cherry. Him and Eddie Kane were my only friends, and literally saved my life, so I stayed in Owen Sound. Even though I went through 3 hospital stays since then in Owen Sound, I haven't made a better move in my life. I regularly was able to eat for free 2 squares a day at Dean Cormier's Sally Ann's Soup Kitchen. There's a picture of him, by the way, going around. Rodway Norman got me into Union Place, and from there I was able to join Community Connections. And Han Prosser, my landlady, made sure I stayed on my meds this time, dispensing them at regular times from the out-of-counter. I still am living in her old apartment today. She made it affordable. She was a saint as far as I was concerned, Han Prosser was. Around 2002, I was asked to take the place of Norma Land as a volunteer receptionist at the Union Place desk. Norma's shoes were sure hard to fill. She had died, and she had been indispensable on the whole to both Nancy Walker and Jackie Caddo, as well as Steve McNall and Rona Lynn and Colleen on staff at Union Place. Even though she didn't have 2 nickels to rub together, she regularly paid her bus fare and sent cards to people in the hospital or to go visit them on the 4th floor, even if they dropped in only a couple of times to Union Place. She was efficient, thorough, she was discreet, she was wonderful. We who knew her still really miss her. There's a picture of Norman in there too. Union Place was also a lifesaver for me. I got a job there, I got paid, something I thought wouldn't happen again for me in my life. I got life skills help, especially in the area of good nutrition. As a newly diagnosed diabetic, the staff's help is essential. I get rides to my hospital appointments from them. Working in the kitchen has been fun, Safe food handling has been a course I've taken several times, and that is generously provided by the UP staff, and it's top-notch for anybody that wants to serve food to the public. Nonviolent crisis intervention has also been another course I've taken a few times. With it, we've learned self-defense and psychology techniques to use during those moments of attenders' dire stress and breakdowns. Recently, we've had an increase in afternoon programs at UP. Crafts is a favorite and is usually held on Mondays. Sup with Up is a very popular one where we learn to cook and bake various dishes. In the winter, we can participate in the Pup Pigs hockey team at the Julie MacArthur Arena, and we absolutely love cheering them on. Also, we go snowshoeing when weather permits. Going bowling has been a favorite, although we can't do that now. The bowling alley is shut down until probably September. It might start up again. Wiarton's Greenhouse has sponsored a curling bonspiel for several years, and our other Owen Sound group, Community Connections, has recently been putting on more curling events. Sometimes UP and CC participate together in a karaoke afternoon, and that's a lot of fun with Jackie heading it. You've never heard anybody sing like Jackie, I'll tell you. Did she ever sing? Union Place has a wonderful garden program, and it's a big draw for workers in the spring, summer, and fall. We begin work this year on Wednesday, May 21st, and there are 12 workers this year in the garden program. We have 3 sites near St. George Anglican Church, over by United Way, and over along the harbor wall. We've got 5 cement planter type garden things. I'd like to say that I think Union Place is essential to the well-being of people coming out of the hospital or detention centers. Whether they are members or not, they are treated with the highest respect. Their privacy is assured with the utmost confidentiality. They are nurtured and appreciated as individuals with something to say and something to offer, and the staff there bend over backwards to help us. They really do. It's wonderful. The community brunch program has been the most rewarding to me. When I can't afford to eat at home, I can eat there. When the need comes to the door, they get help. They really do. When they need to replace ID, there's someone to help with that. When they need court assistance, there's someone there to assist them. No one is turned away unless drunk or rowdy, and they get takeaway if they are. They simply come up and take away lunch and let them go on their way. They get hope there. Other cities could do style similar programs after Union Places and the CMHA here. When you're in Owen Sound, drop in to see us. We're at the back of CMHA for San Luis, just down the street from the Metro store.